when considering evaluation of and management of nose disorders, we cannot leave out epistaxis. Let's go through this. It, also known as nosebleed, is a common problem experienced by most people in their lifetime. The epidemiology is interesting. About 60% of the population. It's the second most common emergent otolaryngologist admission, and it's highest in children less than 10 years of age, and then 70 to 79-year-olds. Most are idiopathic, some susceptible due to fragile mucous membranes, nasal trauma, rhinitis, nasal dryness, nasal septal deviation, alcohol use, or chemical irritants. Systemic conditions, both genetic or acquired, anticoagulation disorders, and hematologic cancers, and anticoagulation meds. So we got to keep a lot of different causation in our mind. The pathogenesis, there's either anterior or posterior bleeds. 95% are located in the Kesselbach plexus. So that's that vascular plexus on the anterior nasal septum, and they're associated with irritated mucous membranes or trauma. The trauma can come from like a ball hitting the nose or picking the nose. Posterior bleeds, which are just a fraction, 5%, really much more serious, and they branch off that sphenopalatine artery. It may be associated with vascular disease, and they are much more difficult to control, as I said. So the clinical presentation is either ranges scant to copious bleeding from nares. It's usually unilateral nosebleeds or anterior with continuous moderate bleeding. Small clots may emerge. Posterior bleeds really are seen bilateral presentation. Severe bleeding. It's difficult to treat, and there's bleeding into the pharynx. So on our physical exam, we want to determine vital signs and airway safety first. We have that patient sit up, tilt the head forward, and apply firm pressure for about 15 minutes to the anterior aspect of the nostril that the blood's coming from. If trauma is present, we got to assess for fractures. Postpone the internal exam unless the bleeding will not stop or the nasal compression causes postnasal bleeding. So clear the blood with suction or blowing to assess the site of the bleed if that's necessary. But first of all, the intent, if you really suspect that anterior is bleeding, which is 95% of the time, you want to go ahead and go through the method of controlling the bleed with pressure and correct posture. Topical vasoconstrictive agents may be used, such as Afrin, to control bleeding. Irrigation may be used to clear the nares to identify the bleeding. Diagnostically, you've got to consider the cause, and first you make that impression. You form that clinical reasoning: is this anterior or posterior? And is there a confounding reason they would be bleeding? Otherwise, trauma, it's in the history. You ask them, were you picking your nose? Were you blowing your nose? And sometimes with severe bleeds, we've got to get a CVC with diff, with type and screen cross-match, because we can anticipate a volume depletion. PT and INR in patients on an anticoagulant med are just a standard and expected. So most nosebleeds can be managed with compression to the anterior nares for about 15 minutes. Patient sitting upright, a little lean forward to avoid swallowing the blood. Topical nasal decongestants can be used. Chemical cautery or electrocautery, small amounts of petroleum are applied, and watch that patient for after 30 minutes after the cautery has occurred. Sometimes it's silver nitrate stick, but you got to be able to visualize. If the bleeding continues, nasal packing may be used, and if the nares is packed, then they need an antibiotic. to prevent infection. Referrals, every time posterior bleeding requires a referral and possible hospitalization. So how do we educate our patients? Avoid vigorous exercise and aspirin-containing meds for several days or weeks after a nosebleed. Avoid tobacco and hot, spicy foods related to vasodilation. Avoid trauma, picking, hard blowing. Moisturize the mucous membranes once or twice a day with petroleum, nasal saline, or bacitracin, and then educate those patients how to treat a nosebleed at home properly and when to seek care.